Mrsa bacteria live everywhere, and I mean everywhere. They've been found on keyboards, desks, pens, couches, counters, tools, skin, and even pets. Another important carrier place is personal hygiene items. Even though they're carried on the skin and in the nose, they can live for months on dry surfaces. And as you probably know, Mrsa can cause serious diseases such as pneumonia, sepsis, wound infections, sinusitis, and the one that really scares people, and with good reason, necrotizing fasciitis. Patients can acquire Mrsa while in the hospital. They can get infected by way of openings in their skin, such as surgical sites or IV sites. Mrsa can also make its way into the body by other tubes or devices. Mrsa is spread by contact, but causes infection by entering an opening in the skin. It can be any opening, even microscopic ones you're not even aware of. Since Mrsa can cause certain conditions, you should check for Mrsa if you see skin infections or pneumonia-like symptoms, or if the patient mentions an area that's itching, red, and has pus. Mrsa-infected areas are sometimes mistaken for a spider bite. About 85% of infections come from hospitals, and the strains in hospitals are much more resistant to antibiotics. Improper care of hospitalized Mrsa patients are a risk to other patients and to healthcare workers. Isolation techniques are very important. A Mrsa patient should optimally be in a private room, but if they can't be, contact your control staff to find out what to do in the particular situation. There needs to be a green isolation sign outside the room. Make sure that PPE is stacked outside the door and that examining equipment like thermometers and blood pressure cuffs are dedicated to that room only or are disposable. Isolation precautions should be taken by anyone entering the room, including family members. Make sure Mrsa patients' rooms are cleaned often. If you need to care for a patient's hair, wash their comb or brush before and afterward, and wash your hands. You must wash your hands before and after transporting a Mrsa patient, and throw away the PPE you wore when in their room. The patient must wear a clean gown or be covered with a clean sheet before leaving the room, and no open infected areas should be exposed. Notify the people in the area you're taking the patient to so they can use proper precautions. If you'll be handling the patient in the new location, wear new PPE. Don't try to clean the old ones. Wipe down what patients are being transported in and have them wash their hands. Make sure the entire room is cleaned after a Mrsa patient leaves. Look especially for commonly touched areas like doorknobs, bed rails, and so on. Since Mrsa can live anywhere, your instruments, computers, and the objects you come in contact with every day can be infected. And joining us right now is Ann Kuhl. Ann Kuhl is our expert on Mrsa here at Sierra Vista Regional Health Center. And thank you very much for spending some time with us today. I'd like to talk a little bit about Mrsa and how Mrsa can affect us here in the workplace.
Absolutely. It is an organism that is in the community. It is also something that is within the hospital, and it can potentially be a big threat to people.
Okay. And when we're handling patients here in the facility, what kind of precautions can we take to just help prevent any type of inadvertent infection?
The best thing that anyone can do at any time is to keep their hands clean. Good hand washing with soap and water, as well as, or the use of alcohol hand sanitizer. Both are very, very effective in preventing the spread of Mrsa.
So it's important to even just stop, if you're in a hurry or whatever, after you've dealt with a patient, to just make sure you sanitize your hands or wash your hands as well.
Absolutely. It is. Sometimes it's easy to forget when we get in a hurry, but it is something that's very important.
So we don't want to be afraid of Mrsa, but we just need to have an awareness of it. And that goes for our clinical and even the non-clinical staff. Is that correct?
Absolutely. That's very true.
And how does the non-clinical staff become exposed to possible Mrsa infection?
Mrsa is, as I mentioned, everywhere in the environment. It is not only within the patient room, in the patient's bedside tables, on their beds, on their curtains, but we also find it on surfaces at the nurses' stations, at the desk, on computers, on a keyboard mouse, on armchairs, and doorknobs, things like that. All of those items potentially become contaminated with Mrsa throughout the day.
It's just another reminder again that you always have to wash your hands in order to keep yourself clean in this environment.
Absolutely, absolutely. No matter what we're touching throughout the day, potentially could be contaminated with Mrsa.
Okay.
And to keep the hands clean will definitely keep you safe.
When we're actually dealing with a patient one-on-one, what should we be aware of mostly?
The best thing that we can do when we're caring for patients that we know have Mrsa is to institute isolation precautions, which would include using a disposable gown to cover our clothing and disposable gloves to keep our hands clean while we're caring for the patient. When we're finished caring for the patient, we need to take the items off, dispose of them in the patient's room, and clean our hands either with hand washing or with hand sanitizer. And that's going to keep ourselves as healthcare workers safe, as well as keep the rest of our patients safe.
Now, if somebody feels like they may have come in contact, unprotected contact, with a Mrsa patient, what might they do?
There really is no specific measure that they need to do. That just emphasizes the reason that good hand washing, good hand hygiene is important all the time, because we run into Mrsa at all types of environments, wherever we are, and it's really important to keep our hands clean all the time, at work as well as at home.
People who get the community-acquired strain usually have several of the following in common. They're in close quarters or contact, have poor hygiene, are in situations where they can't fully attend to it, get openings in the skin, and share contaminated items. Some examples are school children, the armed forces, firefighters, and people living in dorms. The risk of coming in contact with Mrsa is everywhere, at the store, at schools, and at work. Caregivers who work in hospitals can become infected by patients bringing in community-acquired Mrsa, but caregivers who work outside a hospital, or even just someone who's helping out in need, could also be at risk. No matter what industry you work in, you still want to do your best to prevent getting or spreading Mrsa. Anytime you handle blood or bodily fluids, like when giving first aid or cleaning up vomit, you must wear gloves and wash your hands immediately afterward. If you think someone has Mrsa, isolate them from others and call medical professionals. After the person leaves, scrub the area with disinfectant. Again, look for everyday surfaces. Then, dispose of cleaning cloths and wash your hands thoroughly. A few simple steps can keep you safe no matter where you are. Good hand hygiene is the best way to prevent the spread of Mrsa. You can use soap and water or alcohol hand sanitizer. After all, you don't know who's touched that hand railing or box of cereal. Washing your hands often can help you stay safe while at home and at work. When caring for patients in the hospital, use contact precautions. This means putting patients who are infected with or are carrying Mrsa in a private room. Always wear gloves and a disposable gown when entering the room. Remove the gown and gloves and perform hand hygiene before you leave the room. If you come in contact with someone carrying or infected with Mrsa, or you handle bodily fluids, wear gloves and make sure to disinfect your entire environment. Anything that kills bacteria will work, so wipes, sprays, soaps, and cleansers are all great. So wash your hands often and stay safe while at home and at work.